So you do a lot of bone grafting. In what type of procedures do you have to do that?
Generally, the procedures that we do bone grafting are not the patients that need a full set of teeth.
Okay.
Because in bone grafting, we're looking to develop bone in one particular area. So usually they're missing a tooth in a given area, and so we'll bone graft there. So what we do is we have stem cells or bone grafting material, and we mix it with the patient's own blood. We draw blood from the patient and draw out their own growth factors, and we make a little mixture of it, put it under the gums.
Like you inject it in there? Kind
of inject it in there in a very minimally invasive procedure, and the bone grows in typically around 3 to 4 months. The reason why we don't have to do that very often in the patients that need all their teeth is because I only need to put in 4 implants, and I generally can find 4 areas to put the implants
to give
into,
a full set of teeth.
To give a full set of teeth. In those few patients, like I talked about my golf buddy in another moment, he didn't even have those areas, so we had to do bone grafting in different spots for him.
So bone grafting doesn't hurt anymore. I mean, like in the old days, you were telling me the bone grafting was a big deal. Now it's not.
Yeah, bone grafting back then was they took bone from one part of your body to another part, typically the knee or the hip, which was more painful from the site that you took it from than where you're putting it back. But that's not necessary. We can grow bone just as efficiently and just as strong without using your own bone.
So it's not something to be afraid of, pain, things like that?
No, it's not a painful procedure.